Good afternoon, everyone. I'm coming to you from the Red Corner Chat. It's Shamila Ramjawan, and today we have a really awesome guest on the show, Dr. Hema Kapoor, who is a laparoscopic and general surgeon all the way from Delhi in India. Dr. Kapoor, welcome.
Stop this. Can you please repeat it? I cannot hear your voice.
I said, welcome to the show.
Oh, thank you so much. Thank you so much.
So, Dr. Kapoor, you are doing such amazing work out there. Can you maybe tell me a little bit about who is Dr. Kapoor?
I'm Dr. Hema Kapoor. I'm a general and laparoscopic surgeon. So I have my own hospital in Sector 14, Gurgaon, where I have a well-equipped operation theatre. So I do all the surgeries like abdominal surgeries, uterus surgeries, breast surgeries, anal surgeries, like at my place also. And I'm a surgeon at NSG Manese, where they train the Indian Army Commandos. I'm a head of Department of Surgery there.
Wow, that is absolutely amazing. You've got quite a task on hand. I just want to know a little bit about your family and your background. Why medical school? Why a doctor?
Actually, my grandfather was a Hakim, like Indian doctor, what you say. So my grandfather was a Hakim, my father is a doctor, and my mother was a doctor. She was a gynecologist in the Indian Army. So that is why from the childhood, I had ambition to become a doctor only, So that ways.
What?
And surgery is a very male-dominating branch. Surgery is a very male-dominated branch. And when I did my MS surgery, I was amongst the 2 lady surgeons who did their MS, and in Gurgaon also there are 2 laparoscopic general surgeons, basically. 2 female surgeons, because it's a male-dominated branch surgery.
Yes, how does it work being in a male-dominated field?
What do you say? Can you please repeat it, please?
How does it work for you? Are you comfortable being in a male-dominated field?
Initially, when I was doing my MS, it was quite difficult for me because every time I used to have pain, I used to have periods, I used to have dysmenorrhea. So the males used to say, okay, she's a girl, so she just throws tantrum. So, and I had to work in that pain because there were other males. I was the only female and they were all males. But yes, staying with males made me very strong. Like I don't cry over little things like females do. Like that is what they taught me because I was all with males. So it has made me strong. But initially I had problems because they say, oh, what a girl can do. You cannot do a surgery, you're a girl, that way. They had that mentality. But I showed it to them that I can also do it over a period of time.
So tell me about your hospital. You got a 35-bed hospital that you're managing and own it as well. Yes. Can you tell us a bit more about that? Whereabout is it? The name of the hospital? What you specialize in there?
Okay. The name of the hospital is East West Medical Center. That is in Sector 14, which is a prime location in Gurgaon. That is half an hour from Delhi. My center is almost 15 minutes from the international airport, Delhi International Airport. So we cater to all the patients like who have to undergo surgery, like gynecological surgeries, laparoscopic surgeries, like breast surgeries, anal surgeries, abdominal surgeries like gallbladder removal, appendix removal, colon surgeries. And we have medical specialists also. It is a multi-speciality center with a well-equipped operation theater also. So like we can, basically we were looking forward for international patients also. But I had no contacts for international patients because they pay so heavily in corporate hospitals. The same surgery would charge you 2 lakh rupees, and in my center it would cost you 60,000 rupees because I do it in the corporate hospital. There they make a bill of 2 lakh rupees, but if I do it here, I would make a bill of 60,000 rupees. So I was wondering how to get in touch with international patients because a lot of patients from Africa, they come to those corporate hospitals. So that would be a help to them also if I could connect to those patients, those international patients, basically. Because they spend so much money in corporate hospitals in India. The same work we can do it at a smaller setup, also in lesser amount of money. So that is what was concerned.
Well, that is awesome because you're on a global platform, and I'm sure someone is going to watch this and listen out that you're putting it out there that you want international patients to come on board. Why not? You know, everything is so expensive, and with COVID-19, I think it's unaffordable for a lot of people to actually have medical treatment in other aspects, you know, other than COVID-19, especially when it comes to surgery, etc. So I'm sure people are going to watch this and, you know, there's an avenue and it can be done at a cheaper rate. But just going onto COVID-19. How has that impacted? I know it's impacted India. India is now number 3 on the list, and if I can look at the stats, 2.5 million people infected with 49,000 deaths. So in your area, how has it impacted you? Do you have any COVID patients, or just tell us a little bit about that?
So actually in India, you can say that the COVID form is the virulence is quite less. Patients are recovering very soon. And moreover, like the patients which I have come across, none of them was COVID positive. And the reports are also not reliable, basically. They are negative ones, but after a few days, it turns out to be positive. And basically, they say after 5 to 7 days only you should get your COVID done. But like there are patients, but the death rate is, as if you see the population of India, the death rates are very less. India has a huge population, so such a small amount of death rate hardly matters. But people are recovering quite soon. They have a good amount of immunity, so they're recovering quite a lot. People around me have recovered, most of them. I've hardly heard of anybody dying in my area.
Okay.
Yes, people who have comorbidities.
That's great. So what sort of testing you do when people actually come to the hospital?
Actually, before the surgery, it is a mandate, like before you take up a patient for surgery, so we do an RT-PCR test. So if the patient tests negative, then only we take up the patient up for the surgery. Otherwise, we do not take up the patient up for surgery. And like I work for the Indian Army Commandos, so they are also very particular. They don't let anybody come inside. If somebody goes on leave, they quarantine him for 14 days before joining the duties in the Indian Army also. Like, where they train the commandos there, the hospital, where I go. So that is what.
Okay, so so usually the medical practitioners or medical essential services people are at high risk, and you have to take extra precautions because at the end of the day you have to go back to your families. So what do you do? Do you have the full gear on with the protection from COVID-19, and then you get home, and what do you do? Just take me through that.
So basically, we like whenever we are doing medicals, like I'm on panel of DLF also for all the medicals. So whenever there's a high volume of people, so we put on that PPE kit. But you really feel very hot in that PPE kit. And when we have a more bulk of people, more bulk of exposure, then we put on the PPE kit. But in the OPD, I put on just the mask and the hood if required. That is all. And like because most of the patients who come to me, we make sure that they're not COVID positive. They don't have any symptoms. But yes, like if we are being posted in an area where there are more number of patients, the viral load is going to increase. Then we would need a PPE kit there. But I am just using mask most of the times and the hood and PPE kit if I have to do medicals because the number of patients is 200 or 100 or 100 to 200 times. Then only I use the PPE kits. Otherwise, no.
Okay, and then the nearby hospitals that have COVID patients. So what sort of procedures do they do? Because I know, in every country it's a little different, but in India, what do they do in terms of testing? Do you have to wait for symptoms first and then go and get tested, or how does it work?
Actually, in India, they're just people who have symptoms, people who have some symptoms. Actually, COVID, nobody knows the symptoms exactly. They're all vague symptoms. So, like, if you suspect a patient, then only they're getting a COVID test, and most of the times. Like it is not like that everybody is getting tested, but only people who are having some symptoms, they are getting treated and like they are getting tested, not all of them. So like basically it is all symptomatic treatment which the patients are getting. There's no fixed protocol. Like there were issues about chloroquine, that chloroquine causes cardiac arrhythmias, and I've heard about 2 anesthetists dying because of these arrhythmias because of chloroquine. But like there's no fixed regimen for treatment. It's all a symptomatic treatment the corporate hospitals are giving. Nearby hospitals are also giving the symptomatic treatment.
So from a medical point of view, what would you say are the common symptoms that's being experienced there?
Pardon?
What would you say are the common symptoms that are being experienced there?
Common symptoms is like difficulty in breathing, fall of saturation. I came across a patient who had fall of saturation, like the PO2 levels, they fell down, fall of saturation, difficulty in breathing, irritation in the throat, and at times gastric symptoms like diarrhea and all. It could manifest that ways, but moreover, difficulty in breathing is the most common symptom.
And what sort of treatment are medical practitioners actually doing there in India?
Actually, it depends. Like if the saturation is quite low, they can put you on ventilator support also. But if it is little bit low. They can put you on a high volume oxygen with high pressure, hyperbaric oxygen. With high pressure, they give oxygen to you. So the patient mostly recovers with antibiotic. Mostly, it is manifesting as viral pneumonia only. The virus is manifesting as viral pneumonia. On the CT scan also, they are getting such pictures. So they give a conservative course of antibiotics with high concentration of oxygen at high pressure to such patients who have low concentration of oxygen in the blood. So that is what.
Okay, and I believe that the ventilation process is quite hectic and it's quite a strain on the body as well. Do you want to maybe just take us through that? Because I think a lot of people, when they hear ventilators, they really don't know what it means. So do you want to just take us through that and how it works? How do you sort of insert it or whatever that's going to actually help others?
That's a very intelligent question. So you've heard of a pulse oximeter? You put it on your finger, the pulse oximeter.
Yes,
so
I did.
Normal values are the PO2 values, the oxygen values should be 99%. Okay. So if the saturation falls below 80%, we say the oxygen saturation in the blood. So you put it on your finger and you can see it on the monitor how much is the saturation. Mostly in a healthy individual, it should be 99%. Okay. So, but if it falls less than 80 or if it falls less than 90, then you start needing an oxygen support. And if it falls less than 80 again, you would need a BiPAP support. The BiPAP is a form of a ventilatory support. But a ventilator is when it falls further below, less than 70. You have to intubate the patient. You have to put in a tube in the trachea, which goes through the lungs, and then you have to provide the oxygen to the patient so that the saturation increases. So we give an artificial breathing from outside, and we treat the condition, like the lung condition, when the infection which a patient has with an antibiotic or whatever. And as it recovers, the saturations also improve gradually, and then we wean off the ventilator. We reduce this ventilatory support. When the lungs recover, the oxygen concentration required by the patient will reduce, and then slowly we'll wean off the ventilator, and then we'll extubate the patient, and gradually he recovers. So that is what. So it is not a fear, okay, he's going on ventilator, he's going to die. There's nothing of that sort. Ventilator is only to support you during your bad times. When you have a bad infection, the lung cannot work. So that time the ventilator gives you the breath, and you are giving the antibiotics, so the lungs will heal. And when the lungs will heal, you will not need the ventilator, and then you will take out the tube and you will be off the ventilator. So that is what. So it's nothing to panic about that. If you go on a ventilator, it's nothing to panic about, but you should be very alert about it. You should see that saturation machine is very inexpensive. Everybody can get it at home who has cough, cold, breathing problem for a long time. So they can measure their saturation at home also. If it is falling below 95, then that's a matter of concern. So it should be about 99%.
It seems like quite a process. So just the after effects of the ventilator. I know, well, I did read somewhere that there are effects after the ventilator and people have other sort of illnesses after that, or it's the strain on their lungs or the strain on their body. Do you want to take us through that?
No, actually the tube which they put in can cause irritation in the throat. As such, there are no after effects. There are no side effects otherwise. But yes, like the tube should be taken out gently, and and there are no after effects. Like basically there's throat pain because you put in a tube for a long time. But if the patient has to stay on a ventilator for a long time, more than 10 days or so, they do a tracheostomy here. They do a hole in the neck and put in a tube there. So otherwise there are no after effects. You cannot be on the tube for a longer time, more than 7 to 10 days. So you need a tracheostomy to be done. So the only after effect is that you can have pain in your throat after removing the tube for some days.
Okay, so that is very similar to the spinal surgery, because I had the C5 and C6 disc replacement, and I was actually cut here, and the operation was done through my throat. So it's very similar then.
Yes, it was a tracheostomy done for breathing.
Okay, I understand it fully now. What about the after effects of COVID-19 on the body?
After effects, actually, COVID-19 basically causes permanent fibrosis of the lung tissues. The lung tissues get fibrosed. You know, fibrosis means they become sort of plastic. Usually the tissues are elastic, you understand. So once you have COVID, the lung tissues will become plastic type. Their permeability reduces the lung tissues. So in the long run, the patient can have breathing problems and later on in life because the elasticity of the tissue decreases.
Okay, and then is there treatment for that, or is it something just recurring where the patient has just symptoms from time to time, or how does, I'm trying to understand that.
actually, there are like basically as the patient gets symptoms, if his saturation falls, the problem here is why were patient dying? Because the elasticity of the alveolar walls had reduced. So like symptomatic treatment is the only treatment, high pressure oxygen so that it can permeate the barriers. That is all is required. The symptomatic treatment would be required in the long run, so that like whenever they have breathing problem, it has to be given at a high pressure so that it permeates to the membrane.
Okay, sure. Lots of medical terms there, but it's quite informative. Dr. Kumar, I just want to, Dr. Kapoor, I just want to find out, in terms of testing, you know, there's a lot of people that have symptoms, they go and get tested, some of them get tested twice and it's negative. What would you say in a case like that? You know, or let's put it this way, what about people that have been tested and they're positive, they recover, they have the 10 to 14 day isolation period? Are there any chances of them getting it again?
Like a few cases have been reporting getting them again. And I would say that the tests are really not reliable. You should go as per the symptoms of the patient if he has. Because like usually you should do the test on the 5th to 7th day. That is recommended to get the patient tested on the 5th to 7th day. And once they recover, like after they should have a quarantine period of minimum 14 days. And after that only they must mix up with their family members. But there are certain cases in which recurrences have happened. Like that depends on your own immunity, the comorbid conditions which you have. If you are a diabetic patient, if you have cardiovascular problems, so you need to be more careful about it.
Okay, so talking about comorbidities, what about asthma? So it's asthma, being diabetic, cancer patients.
They are immunocompromised. Yes. They are immunocompromised asthma patients. They can be on steroids also. Even cancer patients are immunocompromised. So they need to be more careful about it.
What would be your advice to people out there to actually stay home, have that extra protection, practice that physical distancing? What would you say to people out there?
If you go to say practically, the social distancing and everything, like you can do it for some time, but after a time comes when you just leave everything and everybody, there has no social distancing at the bus stops or anywhere you see. So you should have a good immunity. You should practice good hygienic habits, put on mask, put on gloves, and come home and have bath. Remove your slippers outside your house when you come back home. So they are the all precautions which you can have. Because like you can protect everything, but like there's a limit to everything. Every day you cannot practice social distancing. Washing vegetables every day, washing fruits every day. That is a good hygienic habit which you should practice otherwise also. So that is what, wearing masks, wearing gloves, avoid going to crowded places. That should be avoided. So that is what I would suggest. And have a good immunity. Like you have a good diet, a balanced diet, and a good diet so that you have a good immunity. That is what.
A lot of people say that you should pump up on the vitamin C. What's your take on that?
Yes, vitamin C improves the immunity. So you should have vitamin C, and it is a water-soluble vitamin. So there's no harm if you have 3 to 4, 5 tablets every day, because it will get excreted in the urine also. That's not a problem. Vitamin B and C is a water-soluble vitamin. So you can have 3, 4 tablets a day also. That is not a problem. So that is going to increase your immunity. And vitamin E has antioxidants also. So vitamin E is also recommended.
Okay, so I actually have a concoction that I make. It's a homemade sort of remedy that I take in the morning. It's more sort of a prevention. So it's basically oranges, lemons. I put in some apple cider vinegar, turmeric, honey, and ginger. And I put all of that in a blender, and I have a glass of that every morning.
Okay, and that's very good. That's good. Like that's got all natural antioxidants and everything. You don't need anything then.
Well, I'm really bad when it comes to popping pills. You know, I don't take any multivitamins. I just think I'd rather just go the natural route instead of taking pills.
That's better. That's better. You get a original quality with it, and you have a good sufficient quantity in that.
Dr. Kapoor, tell me a little bit about your family.
I have my father, my husband is a civil engineer, and I have two kids. Like one is 14 years, the other one is 8 years. So like that is, we are 5 people in the family. So that is what.
And are they at school now, or are the schools closed still for lockdown?
No, the school is closed, and my elder son only arranged for all this Zoom meeting because I never knew about it. So he's sitting here only. So Ishan, he's sitting here with me.
Hello.
So he only arranged for it. And my husband is also sitting there because I never knew about it. So they only arrange for all this Zoom meeting and all.
It's actually so easy to use. You know, we're all getting used to technology now that we can't see people face to face. So we got to get used to everything that's available to us. On a lighter note, you're so busy. You're managing 5 different medical centers and hospitals. When do you get time to rest?
Like rest, the day I think that today I'm not going to do anything, that is the day when I get most of the work. So like my phone is on 24 hours because whenever a patient calls, I have to call up the phone. So there's no fixed resting hours for me, like because when you operate someone, so you have to be alert because if I sleep, the nursing staff is also going to sleep. So for monitoring, I have to be awake in the night also. So that is what. There's no fixed time, but night only I take rest basically.
My goodness, such a busy person. So what do you do for fun?
For fun. I think after I finished on my MS, I didn't have fun. Like it's been long that I've gone out. But now, like my husband was telling that we'll go out for outing. But now I said because of this COVID, I don't want to go out. So at the moment, for doing fun, I sit with my children and my husband and my father at home. I have a lot of fun at home because the whole day I'm out. So I want to sit at home and have fun. And I like going shopping, like females do, like clothes and all and sarees and all. That is my, like, I enjoy doing that. Like, so that is what.
So I'm sure you have a great collection of saris.
Yeah, I do. I do have a great collection. That's true. That's there. When you come to India, I'll call you. I'll invite you home one day.
Oh, thank you so much.
Mr. Udit Raj was telling me that you were there, like at his place. Also, he hosted you for some few days. You have been to India, like you have been to his place.
Yes, yes, I have been to his place twice already. In fact, he hosted me at a dinner party. That was great. I'm looking forward to working in India as well. So yes, I'm in India about 2 to 3 times a year.
Okay. So like looking forward to see you then when you come this time.
Definitely. We will definitely meet, and I'm sure that Dr. Raj will arrange a nice party for us all so we can get together.
Yes. Sure.
Yes, but I just want to wish you everything of the best. Your last words to people out there. You know, this is a global pandemic. It's affecting everybody mentally as well. What is your last message out there to everyone?
Like actually, people should not worry much about it because the mental health is very important because people are lining up into depression. So maintaining a good immunity, good diet, and taking proper precautions, that is the only key, and that is all in our hands. Rest to leave it in the God's hand. This is all we can do. So that is the best we can do. So practicing hygienic habits, they should practice masks, gloves, and if possible, social distancing. Avoid going to crowded areas. That is all. And if you have slight symptoms, get yourself investigated for that. That is also very important.
Thank you, Dr. Kapoor. If one wants to get hold of you, how do they get hold of you?
Pardon?
If one wants to get hold of you, your contact details, how would they get hold of you?
I'll share my mobile numbers. Can I tell you the mobile numbers?
You can say it, yes, so it can be recorded as well.
Anybody who wants to undergo a surgery or wants to have medical treatment in India at my place can call me up at 981-87-580-78, and the other one is 81788-62873. I would text it on WhatsApp to you also, so that if somebody is in need of medical help who wants to come to India for surgery, can contact me.
Absolutely. Yes, I will add it on to the link as well that I'm going to be sharing across all social media platforms. Also, if you can share an email address, because I think it's sometimes difficult for one to call internationally.
Sure. It's the email address is east.west 995 @gmail.com.
Oh, that's easy. That is very easy to remember, and it's recorded now as well. Dr. Kapoor, I wish you everything of the best. Thank you for helping people. I know it's your passion. I can hear it from the way you speak, and I wish you and your family all the best. And thank you for actually coming on board and speaking to us in the Red Corner chat.
Thank you so much. Thanks a lot for getting in touch with me. Thank you so much. Huh? Okay, you also take care. Okay, bye. Huh?